And U.S. Virginia Senator Tim Kaine held a roundtable today to talk about senior prescription drug costs and health care in Charlottesville. Gabby Womack is live in the newsroom with that story. Hey, Gabby.
Hey, Aaron. The roundtable was held at Jefferson Area Board for Aging, or JABA. Kaine arrived eager to answer people's questions and address their concerns. People thank Kaine for making Medicare easier to understand and work through. He also spoke about pharmacy rates and helping lower costs for those on fixed income.
The thing that I'm most excited about under the Inflation Reduction Act on drug cost is capping the total annual cost that seniors have to pay for prescription drugs at $2,000 a year.
Kaine says most manufacturers have capped insulin costs outside of Medicare. He also wants to monitor other drugs that are used a lot and cap those costs as well.
We're negotiating for prices on a whole bunch of other drugs for the first time under Medicare. The first 10 drugs will start to show dramatic savings for people in 2026. And these 10 drugs account for 20% of all the spending for pharmaceuticals under Medicare. So we picked the ones that are the really most used ones.
And it was also an opportunity for others to bring up issues that aren't talked about, like predatory marketing practices.
Medicare Advantage is another way of providing insurance, and there's a lot of disinformation or less information, and that's why it's really important to come to JABA when you're going to get started in Medicare, so that you really understand from an unbiased, non-paid professional what the advantages and disadvantages are of being on Medicare, which supplements, and being on Medicare Advantage.
Kaine says there is no Medicare Advantage bill on the floor of the Senate, but they are currently working on reforms in the Health Committee. Live in the newsroom, I'm Gabby Womack, 29 News at 5.